Hello, I'm Dr. Janelle Jackman, and I'm here to talk about endometriosis. So, actually, the month of March is Endometriosis Awareness Month, which I don't think anybody will know much that it is because obviously we've been quite overshadowed um, by this very serious virus that is occurring right now. I don't want to minimize COVID 19, but I just wanted to talk a little bit about endometriosis because a lot of patients do have endometriosis. A lot of patients have questions about it, and I think now is a perfect time to answer it. The color for Endometriosis Awareness Month is yellow, so I purposely wore yellow today to make this video. So, what exactly is endometriosis? Now, endometriosis is a usual painful disorder. It's usually a painful disorder characterized when you have the lining of the womb called the endometrium being found in other places of the body. So the endometrium should be just within the cavity of the uterus. And when this is found outside of the uterus, for example, the bowel, the bladder, the intestines, the kidneys, the ureters, this is now called endometriosis. It's like ectopic endometrial tissue elsewhere. Now, the problem with having endometrial tissue outside of the uterus, is that it responds hormonally just the same way the tissue inside the uterus responds. So it does menstruate, so to speak, when you have your period, and this can cause serious, severe period pain. So, a lot of times, patients with endometriosis aren't even aware that they have endometriosis because they've been experiencing these symptoms for so long that they think it's normal to have excessively painful periods. These periods are so painful that a lot of patients can't go to school and or work when they have their periods. A lot of patients are fearful, when they're expecting their periods. They get really, really frightened because they don't know what to do to minimize the pain, and they think that this is what everyone experiences. Now, if you have severe painful periods that you're non-functional, or you actually get so afraid to get your period, then you may have endometriosis, and it's not normal to have such severe pain, and you should visit your obstetrician and gynecologist. So, some other symptoms besides dysmenorrhea, which is severe painful periods, people can experience dyspareunia, which is pain during sexual intercourse. You can experience dyschezia, which is pain on making a bowel movement. You can have pain while urinating. You can have just chronic pelvic pain. A lot of patients actually present to us here because they have infertility. And those are usually more of the common symptoms, that you have with endometriosis. Now, there's several theories as to what causes endometriosis. The main common one being retrograde menstruation. So your uterus, do I have a picture of the uterus? I think I do. Your uterus usually allows blood flow out during menstruation this way. But retrograde menstruation is when, for whatever reason, here is very stenotic or closed, and the blood can't come out, or not as much blood can come out, that the blood flows through the fallopian tubes and out, because this is another opening you have to your uterus. And that's retrograde. Now, when it flows out the fallopian tubes, it's now in your pelvic cavity, and now it can form endometriotic deposits that can respond hormonally, just like your lining is, which can bleed and cause adhesions and different complications. Another theory is transformation of the peritoneal cells. Now, your peritoneum, this is called the induction theory. Your peritoneum is basically, how should I explain it? Like lining inside of the pelvic and abdominal cavity. And one theory is that those cells have transformed. Another theory is that cells from since you were embryo have transformed into these endometriotic tissue. Some people think that it's caused from a surgical scar implantation. Like if you had a scar in the uterus, now that uterine tissue is implanted in the scar and can now be now can end up in different places inside the body. And some people think it's a immune system disorder where your macrophages, which is supposed to destroy all tissue, abnormal tissue, doesn't work effectively, and hence the cells from within the uterus can now proliferate elsewhere in the body. So regardless of the theory, when patients have endometriosis, we know the presentation. It's usually severe menses, painful sex, painful bath bowel movements, or infertility, even though there are a few patients who just don't have any symptoms at all, but that tends to be not the common presentation. So, risk factors in getting endometriosis is patients who have never given birth, um, patients who've had periods starting extremely early, patients with shorter menstrual cycles, more importantly, patients who have reproductive tract abnormalities, like if your cervix, the mouth of the uterus, like I was showing you before, if the cervix, which is here, is not open or can't allow blood flow out, and that goes with the theory that I told you. Um, these are all some risk factors for getting endometriosis. So possible complications of endometriosis, as I mentioned before, is infertility. So endometriosis, the endometriotic deposits all over the body can also end up on the fallopian tube, and it can cause the kinking, twisting, and blockage of the fallopian tube, and that can prevent, your egg when it's released from the ovary from entering the uterine cavity. So endometriosis can actually also develop within the ovary, forming an endometrioma, and that can sometimes be so expansive that you don't really have much ovarian tissue left. Without the ovarian tissue, you don't really have much follicles, which means your egg number goes down. And patients with endometriosis do have a slightly increased risk for cancers. There are endometriosis related cancers, so there is a slightly increased risk of the endometrioid type ovarian cancer. So there are increased risks for cancers when you have endometriosis, but not significantly increased. So to diagnose endometriosis, to really 100% diagnose it, you have to do surgery, whether it's laparoscopic surgery, where you can take a little camera and look inside through a keyhole incision. So you have to actually see the endometriosis tissue, and you can take a biopsy and look at it. However, you can sometimes examine on pelvic exam, feel like little nodules along certain ligaments of the uterus. On ultrasound, sometimes you can see endometriomas, which are, as I said, are endometriotic deposits inside the ovarian tissue. Sometimes MRI can pick it up, but definitively you need surgery, which is why it's always not an easy diagnosis, because if we were to put everyone who had severe painful periods under surgery just to diagnose it, you can understand why it's not an easy decision to make to just, say, okay, I'm going to definitively diagnose this. So, there are several different ways we can treat endometriosis. We can use medical versus surgical treatment. And under the medical treatment, we can use pain management versus hormonal therapy. So on pain management, your NSAIDs, example like ibuprofen and naproxen, they are definitely one of the top things that we use. You can get that over the counter, and they help to relieve the pain that is caused by endometriosis. Obviously, they're not doing anything to the endometriosis itself, just the pain. And then you could use hormonal therapy. The hormonal therapy, it helps by stopping ovulation, and hence it prevents the hormonal response that is causing the endometriosis itself to have this painful response. So some example of hormonal therapy would be your birth control pills, preferred the combined one, the one with estrogen and progesterone. You can use gonadotropin releasing hormone agonist and antagonist. Essentially, they both will eventually work to block ovarian stimulation. You can use progesterone therapy. Some people actually use IUDs that gives a localized effect. And then you can use a medication called aromatase inhibitor, which is a class of medication that decreases the amount of estrogen the body has. Without estrogen, the endometriosis it doesn't proliferate, which is the step that estrogen causes before you have your menstrual cycle. So these are ways that we can help reduce some of the painful symptoms in endometriosis. Now, if we're looking at really getting rid of the endometriosis, I forgot one medication, but I did mention it, just not much. There is Orlissa. It's a GnRH antagonist. It blocks your brain from stimulating the ovaries, more or less. And without the stimulation of ovaries, you don't have the ovarian hormones being produced, like your estrogens, etc. So this is like a known medication that's actually made specifically for endometriosis. Now, if you want to definitively treat it and get rid of the endometriotic deposits, then you have to do surgery. And with surgical management, you can conservatively do the surgery, which is like you can do laparoscopic surgery, little keyhole camera again, and literally remove the deposits one by one. This is like for somebody who doesn't have much widespread endometriosis. Unfortunately, though, with this treatment, it can recur or you can miss some deposits. 100% definitive treatment for endometriosis, though, would be hysterectomy and bilateral oophorectomy, getting rid of the entire uterus as well as the ovary. Now, some people have asked me, why can't you get rid of the uterus itself? And really, the uterus is not the problem. Remember, it's the ovarian hormones that is stimulating these deposits. So if we leave the ovaries behind, you still have the deposits inside and you still have the ovary to stimulate them. So the definitive treatment, unfortunately, is very aggressive and obviously only considered in patients who either have really severe symptoms that they don't, and tried everything else and they really, at their wits' end, they're like, no, this is it, I'm going to do this. Or for people who are finished with their childbearing goals, which is ideally the case, that you've finished with your fertility goals, you've had your children, and now you really need to take care of your symptoms, and therefore this is a definitive treatment. If you are experiencing infertility and have endometriosis, it would be best to visit infertility center, reproductive endocrinology and infertility center, so that we can best manage you with the appropriate steps and actions to increase your chances of getting pregnant. Otherwise, a lot of the treatment can be done by your obstetrician and gynecologist. I hope you learned a little something more about endometriosis today. If you have any questions, feel free to ask them and I will get back to you as soon as possible. Have a good evening. Goodbye.